It's hard to know everything, but so many moms that we have bringing their babies in who are struggling with these things, they're not getting identified anywhere else. So I agree, the dental office is a perfect place to not only educate, but then to be able to triage infants and newborns. So we do talk to pregnant moms, and I feel like our place is to talk to moms about a feeding plan. I know nowadays it's really popular to talk about birthing plans, which I am 100% behind. But if you're talking about the birth and you're not talking about feeding, it's kind of like talking about the wedding and not talking about the marriage.
Yes. I love that analogy because we can all relate to that. Welcome to another episode of The Irreplaceable Dental Assistant. And as usual, I have a treat for you. But I don't want you to take my word. I want you to see for yourself. My guest today is Joy Lantz. Joy, welcome to our podcast. How are you doing today?
Wonderful. Thank you so much for having me.
It is truly our pleasure. So Joy, I know who you are and the fullness that you bring, but let my audience in on who you are, what you're passionate about, and why you're here today.
Of course. So I am trained as a dental hygienist. I've been a dental hygienist for 25 years this year.
Wow.
And about 10 years into my hygiene journey, I wanted something different. I have 3 children, and they all had issues with their mouth that I couldn't figure out. And I wasn't trained as a dental professional to know what to do with these issues. So I decided in 2015 to go back, and I was trained as a myofunctional therapist. So that is pretty much what I do these days. I see patients for myofunctional therapy. And I'm also a lactation consultant, which is amazing. I work in a dental office where we do frenectomy releases, and that includes babies. So my passion is babies.
Love that. So as an orofacial myologist, I know you're trained to assess infants for signs and symptoms of airway issues. So what are some of the signs that you look for, Joy?
Yeah, so when we are seeing babies in our office, we do a really thorough intake. We want to know what's happening at home. We just have a little snapshot when they're in the office. So the biggest thing we talk about is, are they having issues feeding? That's usually a big one. If they can't coordinate their suck, swallow, and breathe together, we know something is happening.
Right.
If they're really noisy breathers while they're eating, noisy eaters, or sleeping. Our babies are snoring, and just because that's common doesn't mean it's normal. That usually means something is going on from the structure, and it likely started in utero.
So Joy, as common as those things are, most of us, even those in the medical community, are not even aware that those bundle of things can be put together to make an assessment as to what support that child needs. So when someone is pregnant in your office, or a pregnant mom is connecting with your office, is there some kind of information sheet or something that is provided? Because many of us in dental offices could easily support these parents before babies were born if we were able to say, here's a checklist, or here are some things to look for.
I agree so much, especially for first-time moms. It's very overwhelming. It's hard to know everything, but so many moms that we have bringing their babies in who are struggling with these things, they're not getting identified anywhere else. So I agree, the dental office is a perfect place to not only educate, but then to be able to triage infants and newborns. So we do talk to pregnant moms, and I feel like our place is to talk to moms about a feeding plan. I know nowadays it's really popular to talk about birthing plans, which I am 100% behind. But if you're talking about the birth and you're not talking about feeding, it's kind of like talking about the wedding and not talking about the marriage.
Yes, yes. I love that analogy because we can all relate to that.
Yeah.
So, Joy, what are some functions of the lip and tongue that you look for in an infant? Things that are essential for maintaining an open airway.
Biggest things that we are checking for when kids come in for lips is we want them to be loose. We want their lips to form a seal around the breast or the bottle nipple, and we don't want them actively using their lips. So usually the signs that we'll see in the office are little blisters. They'll have little blisters on their lips, or it'll have this two-tone appearance, and that lets us know that they're really trying to grab on with their lips instead of being able to use their tongue. So that's a really big one for the lips. For the tongues, we are assessing, obviously we're looking for oral ties. We'll have a lot of parents come in though who have been to the pediatrician, and the doctor will say, your baby can stick their tongue out, they're fine.
Yes.
That's not really what we're looking for. We don't function by sticking our tongue out, really. We need to elevate our tongue. We need to lift our tongue to our palate, especially for infants to feed properly. So if they're tied, they cannot elevate their tongue, and that causes that domino effect then to happen.
You know, Joy, it is an uphill battle because as you're speaking, I'm thinking about this 5-year-old boy that I had in my chair, and I was speaking to his mom about his tongue tie situation. And before I could get into the meat of the matter, she says, oh, my dad's a physician, and he said he's fine, he's functioning normally, so I'm not going to worry about it. So I got shut down before I could really have an opportunity to share. And I say this not because my feelings were hurt, but because so many times people in the medical community just don't fully understand the ramifications of tongue tie. And so many of us go through life not realizing why we're struggling with certain things.
You're so right. I mean, we see it. We both probably see it in our practices. That's exactly what it is. And that's why I'm so passionate about the babies, because I know when we see kids and adults, all of this is stemming from something, right? It doesn't just magically start. It's just been a domino effect now for all these years where we've been compensating for all this time, where it really starts to become an obvious problem.
So, Joy, do you identify and address any harmful oral habits in infants like thumb sucking or pacifier use, which may negatively affect airway development, how the mouth is formed, how the bones
Yeah. So it's a fine line. You know, babies like to suck. That's how they soothe themselves. And it's a really important thing for the first few months of life to teach them how to eat properly and just how to soothe themselves. But there are better ways and better things that we can use. So that's what we educate parents about in our office. What kind of pacifiers are better if your baby likes pacifier, and what kind of pacifiers do you not want to use and why? There are pacifiers out there that aren't great and can actually cause more problems with breastfeeding moms.
Don't we know it?
We also have to realize, though, that babies love having their hands in their mouth. That's a developmental milestone of them exploring their world and learning, and that's how they learn, through their mouth. So there are going to be times where their fingers are in their mouth. It's just because when it becomes a habit, that's when we need to redirect sometimes.
Oh, boy. So we spoke briefly about the importance of educating moms before they even deliver, but looking at both parents and the importance of proper breathing and potential consequences of untreated airway issues and educating them. Is there a particular way that you suggest should we as the dental team point them in a direction? Because we want to make sure that patients are helped to become more aware of their baby's needs and encouraging some early intervention?
Yeah, I mean, the first thing is themselves. If we have parents that come in that are open mouth breathers,
Yes.
kids learn by watching. So if they're watching their parents do that, they learn that that is normal and that's what they should be doing. The other thing is when we are investigating in their own child's mouth,
Yes.
sometimes I'll do stretches on a parent's mouth.
Right.
And guess what we find most of the time when we do those stretches? That the parents are tied, so it's coming from somewhere. And once I'm able to point that out, then I can talk to them about maybe what kind of things they're noticing in themselves so they can understand if we treat their baby, and hopefully by doing that early, we can prevent maybe some of the things that the parent is having issues with.
Joy, all kinds of thoughts are going through my head because I'm thinking about all these early care centers for babies and children, where if folks had some ideas of 5 basic things to look for, they could refer to a professional who could then support them. And it's just so much that if we knew even a little, it could make such a big difference. So I really have to applaud you for what you are doing.
Thank you.
Individually and in your office. But it makes me wonder, how can we as dental teams make a difference? What are some things that we could lead this conversation with and start doing tomorrow to propel this knowledge that needs to go out to parents, to grandparents, to aunts, everybody who has influence over how this child is cared for?
So I'm so glad you asked. This is exactly what our program is about. It's called Mini Sprouts, and we teach other dental offices how to see babies and toddlers. Sometimes we get these kids in and we're like, what are we supposed to talk about? They don't have teeth yet. We have to realize that it's not just about the teeth. So there's 6 main overviews that we talk about with Mini Sprouts. So you can talk to them about how they're breathing, right? Breathing is a big one for how their development is going to come about. We talk about nutrition. How are they eating? What are they eating? Things like that. Of course, we talk about dental development. We want to see what's happening with their mouth, palates, teeth. What does all that look like? We talk about oral rest posture because we know where their tongue is sitting is going to help drive that growth and development. We talk about movement because when we have restrictions in our mouth, a lot of times we have restrictions in our bodies, and that's they're not going to be able to hit their milestones, which is huge. And then we talk about sleep. So those are the 6 basic tenets that we go over. And those are things that you can just come up with a few questions for each.
Wow, I'm excited, Joy. I'm excited because I think we've just barely scratched the surface of something that can make such a tremendous difference to the trajectory of an individual's life. So it's almost as if we accept pain and dysfunction as, you got something, I got something, everybody got something, right? There's this acceptance rather than realizing that, okay, this may be linked to this, maybe linked to this, maybe linked to this. So if we can get this early, all of these things could be lessened or prevented. I'm going to share a little secret with you. I've been practicing dentistry for 35 years, and maybe about 10, maybe 12 years ago, I started on this path to learn more about airway and breathing and upper airway resistance syndrome and sleep apnea and the whole gamut of things that come with not breathing properly, not being properly oxygenated. And looking at the same mouths I've looked in for so many years, I now see it so differently.
Yeah.
And I've come to the conclusion, you don't know what you don't know until you know.
That's so true. That's so true. And once you do know, like you said, it opens your eyes up so much, and you
Oh, my
wonder
word.
why you didn't know about this sooner, especially when we're looking in mouths. Yeah.
Yes. And I think it's particularly important for not just the dentist, but the whole team to be sensitized, because dental assistants often spend more time in that treatment room chatting and preparing for the dentist to enter than when the dentist actually enters. So gathering information, forming relationships, being able to be a voice for that parent is a big help to anybody that we're supporting as they come through our office. So, Joy, you have to promise me one thing.
Yes.
Drum roll. That you will come back again and share your wealth of knowledge with us.
I would love to.
But in the meantime, please remind my listeners, my viewers, where they can contact you, because I know a lot of them will listen to this and they will say, let's Google her. So tell me exactly right where they can go to find you.
Sure. So you can come find us on our website, which is Mini Sprouts Pro, and that's Sprouts with a Z. And if you have any questions, you can email me at joy@minisprouts.com.
Lovely. Awesome. Before I end my podcast, I always ask my guests, do you have a particular quote that is near and dear to you that you'd like to
I sure do.
with us today?
And I'm going to pull it up so I can quote it word for word because I love this quote.
Okay.
It says, I believe that investing in our children's development from the earliest age is the single most important contribution we can make to the health and well-being of our citizens, their capacity, and the future prosperity of our state.
Wow.
That is Jay Weatherill, who is the premier for Australia. And I mean, if that doesn't say it, I don't know what does.
I know, right? I'm going to ask you to say it one more time because we heard it the first time. Now we're going to process.
Yes. I believe that investing in our children's development from the earliest age is the single most important contribution we can make to the health and well-being of our citizens, their capacity, and the future prosperity of our state.
Well said. Well,
I agree.
I would say not just his state, but for us all.
Yes.
Joy, it has been an absolute pleasure. Thank you. I'm already anticipating the next discussion.
Thank you so much for inviting me on. I appreciate it.
Wow, and wow. Oh my goodness. Joy had so much great information to give us, and we have to recognize that providing dental care for our patients goes far beyond filling teeth and cleaning them. We have the opportunity to educate parents or parents to be about what to expect from their babies and what to look out for if there are challenges so that they can be addressed early. Listen, did you hear what she said about the baby's lips needing to be loose, and if they were blistered or two-toned, then that would require further assessment. And of course, we know about ankyloglossia, the tongue tie. It's not so much important about how far out the tongue can go as it is to see how far up it can go to touch the palate. And if it is not functioning so the baby can latch and suck and eat comfortably, it's going to be a lifelong problem. There are 6 tenets that she told us that we could look at. And the first one is breathing, then nutrition, dental development, oral rest posture, movement, and sleep. Now, if you want to find further information, remember you can reach Joy at Mini Sprouts. She is quite willing to answer questions and to just spread the word as to how we as dental offices can make a difference, not just in the lives of our patients, but also in the lives of our patients to be, educating expectant mothers. Extremely important, especially if it's their first child. Knowing what to expect, what signs to look out for can be so empowering. This is why life is better. Life is great. Life is fantastic when we live, learn, and grow together. If you haven't yet subscribed, please subscribe to any of the platforms: YouTube, Apple, Google, Spotify, wherever you find us popping up, so that you will never miss an episode. See you the next time.